Hello again, I'm Dr. Nev and I'm a licensed psychologist. This is part 8 of my 10-part series on depression management. I utilize these strategies with my clients in private practice and I hope you will find them to be useful as well. If you are experiencing significant distress, please contact your local psychologist. In today's video, we will discuss additional behavioral techniques that you can use to help you manage your symptoms of depression. Sometimes you may feel like you have very little control over your feelings, but there is always a little something that you can do to make your situation a little bit better. The first technique we will discuss is called behavioral activation. With behavioral activation, the goal is to increase the number of pleasurable activities that you can do in your life. So ask yourself, what are my hobbies? What are the things that bring me joy, that bring me pleasure? Maybe you like hiking, attending sporting events, hanging out with friends, fixing up old cars, crocheting, whatever that thing is for you, go ahead and do more of that and also do it more frequently. The second part of behavioral activation is exploring barriers to behavioral activation. So is there something in particular that's making it hard for you to engage in those hobbies or goals? If so, what are some ways that we can remove those barriers so you don't have anything standing in your way of crocheting, playing guitar, going to the movies, and so forth? The second technique we will discuss is related to improving motivation, which kind of ties nicely into behavioral activation. So most folks who struggle with depression tend to have quite low motivation from time to time, and occasionally they might feel like there is zero motivation to do a whole lot of anything. So the goal with motivation is to not wait until the motivation strikes. The point is to just start with something, get something done, even if you have zero energy and zero desire to do that. The key piece with motivation is also keeping it simple and keeping it measurable. So for example, if you'd like to learn how to play guitar and you've never played in the past and you have an old guitar sitting around, one thing that you can do is start small. Maybe check out some YouTube videos, figure out how to play chords, and maybe decide that every Friday or every Thursday at 7 o'clock, from 7 to 7:30, you will sit down and start learning how to play a few chords so you can become a little bit more masterful with learning guitar. Another key thing too is minimizing distractions. So oftentimes motivation is hard to sustain if you're constantly distracted with things going in your environment. So find a space that's different. Find a space that's more calming, more soothing. It can be your bedroom, your garage, even a park bench, just somewhere that you're not typically hanging out that you can use as your designated space for your particular hobby or goal. Another important piece to remember when it comes to motivation is accountability. So is there somebody that can actually keep you accountable? The more people you share your goal with, the more likely you are actually to stick with it. So don't keep your goals or your fun activities to yourself. Let other people know what you're working on so they can periodically ask you about it from time to time, and then it just makes you more accountable to yourself to continue that activity. The third and final technique we will discuss today is a very important one, and it relates to reaching out for help. Being stuck with your own negative thoughts for too long can definitely lead to suicidal ideas, planning, or attempt. And if you start thinking about suicide, that right there is your cue to reach out for help. Writing those thoughts out on your own can be very dangerous, especially if they continue to progress and become more frequent in intensity. Also, do not isolate when you are in a crisis. Talk to somebody, anyone. And I will provide you a resource below this video to the National Suicide Crisis Hotline. And I would also recommend speaking with your therapist if you have one. And if you don't have one, go ahead and Google therapist near me, psychologist near me, and you will probably find quite a few resources. Lastly, if you are having an immediate emergency, if you do not trust yourself with your thoughts and with your behaviors, go ahead and call 911 and you can get that immediate assistance right away. Or call a family member or friend who can call 911 on your behalf if you're not comfortable doing that yourself. If you have a plan or intention of hurting yourself, please tell somebody immediately. Tell a friend, a family member, coworker, anybody. Those thoughts are very serious and they can escalate very fast. Before you know what happens, you can go from point A to point B of making an attempt. Remember also that most suicidal thoughts do pass over time, and studies actually show that in some cases, individuals who have survived their suicide attempts change their minds mid-attempt. So what does that go to show us? It goes to show us that suicidal thoughts do not linger forever. You may want to die 1 second, but then 5 minutes later you may change your mind. An hour later you may no longer want to die. A week later you may be in a completely different headspace. So the key here is to get the help in the moment when you are feeling suicidal to prevent yourself from doing something that cannot be taken back. Again, it is important to recognize when you are experiencing a crisis and to not delay getting some kind of help. So today, I wanted to again remind you that depression does not last forever and that feelings do come and go. You just have to learn how to ride out the storm. And the key takeaway here is that you need to work on practicing some of these positive coping skills and behaviors even before a crisis strikes. So that way, when there is a crisis, you will kind of know what to do. And I would really encourage you that if you do struggle with suicidal thoughts from time to time, jot down the name of the National Suicide Hotline. Just keep it close by in case you ever need to refer to it. Thank you so much for watching part 8 of my 10-part series on depression management. I hope you found this video to be useful. And if so, please subscribe so YouTube can alert you anytime I post a new video. Thank you for your time and take care.